What is a virtual ward? Virtual wards provide hospital-level care and remote monitoring in your own home. They allow you either to stay at home, receive care at home, or after being in hospital, to continue your treatment at home where you are most comfortable. There is emerging evidence to show that patients have better outcomes when treated at home rather than being treated in hospital. Virtual wards have teams of healthcare professionals near to you who can provide high-quality care to you, either face-to-face, in your own home, or remotely, usually supported with clinical advice, cutting-edge monitoring devices, smartphones, and other technology. They are evolving to manage a wider range of medical conditions that would otherwise be treated in hospital, particularly for frail patients and those with acute respiratory infections. Thousands of people across England are benefiting from being treated at home on a virtual ward. One of these patients needing hospital-level care was George. George, 82, lives at home with his wife Val, 76, and his dog, Frank. George has been feeling unwell and this morning was seen by his GP. The GP arranged some tests which showed a severe kidney infection. Rather than being admitted to hospital for treatment, he is offered the option of being supported at home by a virtual ward. George is assessed at home by healthcare professionals who are able to start his treatment, provide equipment, and ongoing remote monitoring. A healthcare professional visits George at home to take a blood test, which identifies that George needs a change in medication. George is monitored and reviewed daily through virtual consultations, and his wife Val helps him to upload his daily observations so they can be reviewed by his healthcare team. After a week of remote monitoring, George was stable and discharged from the virtual ward, feeling much better, and his kidney infection had been treated. George said, "I was over the moon when I realized I could have treatment at home rather than going to hospital again. The care the team provided was second to none, and I felt so much better being at home with Val and my dog." George was supported in his own home by a team of virtual ward healthcare professionals, typically made up of clinicians including nurses, doctors, pharmacists, physiotherapists, and other therapists. What's next? The NHS is looking to provide as much out-of-hospital care as we can through virtual wards, particularly for patients like George, who will benefit more from staying at home than being in hospital. We're working to increase the general awareness of the benefits and availability of virtual wards, especially for patients diagnosed in the community with a condition that needs urgent hospital-level care. This includes expanding on the types of conditions that can be treated on a virtual ward so more people can benefit. All our staff work incredibly hard to ensure that you can receive the right care at the right time and in the place that is best for you. To find out more, visit www.england.nhs.uk/virtual-wards.